Herbs and Essential Oils for Killing Lyme, Babesia, and Bartonella. Written by James Schaller, MD, MAR, and Kimberly Mountjoy, MS. Why use natural treatments for Lyme disease, Babesia, and Bartonella? First, these can be very brutal infections that can cause severe misery and hinder your functioning. So having every option is wise. These infections have persister cells which survive after routine synthetic antibiotics. In the case of Lyme disease, the usual spiral-shaped bacteria can transform to have protective round bodies that resist prescription medications. Most infections, such as Lyme and Bartonella, live behind a slimy biofilm that typical antibiotics struggle to penetrate. And according to a Babesia expert and friend, Dr. Henry Lindner, Babesia also lives in nests, making it hard to see in routine blood tests. Synthetic antibiotics consist of only one precise chemical, which makes it easier for the bacteria to defeat the antibiotic. This is what we call resistance. But herbs tend to have more than one killing agent. And it is hard to defeat multiple herbal antibiotics at the same time. Each may have 1 to 3 antibiotic chemicals. That is a great deal of healing power. For example, Uncaria tomentosa, cat's claw, at a very low concentration, showed profound reduction of Lyme's biofilm, the slimy layer that makes antibiotics fail, because they cannot penetrate the biofilms. But Uncaria does not kill the Lyme bacteria. However, adding Otoba parvifolia, banderol, extract kills over 90% of the bacteria, while it had no effect on biofilms. Simply, let me share a critical truth up front. The treatment of Lyme, Babesia, and Bartonella requires different unique treatments, and if you are using herbs or synthetic drugs, you will always need more than one treatment. You need medical combination treatment to have success. If you look at naturopathic doctor, ND, herbal products, notice they usually have multiple agents in a liquid tincture or capsule. One limitation of herbal and essential oil treatment is that the research on their use is limited. And most of the main studies on the use of herbs as bacteria killers are merely test tube findings in a lab. There is little testing in humans or even mice. But they have all been used for hundreds, or even thousands, of years. I have prescribed them for 29 years to help heal my children, wife, patients, friends, and myself. Most advanced physicians routinely use synthetic medicines which have limited research for a particular illness. For example, Monica Embers published the effect of common and emerging synthetic drugs against Bartonella in the lab, not in humans or even rats or mice. Useful lessons, but it is limited. Therefore, both natural and traditional medicine often need human trials to confirm findings in the test tube. Why promote these herbal options? Simply, I am not writing a fat textbook about herbs and essential oils. This will be short and only give the bottom line, or few readers will finish it. And many proposed herbal treatments for Lyme, Babesia, and Bartonella have minimal publications. So, this small book fills a need. As a trend, herbal treatments have modest to low side effects, though not all are recommended during pregnancy. If you are pregnant or trying to conceive, consult a naturopathic doctor about any herb before use. Since these tick or flea infections can be hard to cure fully, healers need every treatment option that makes sense. Please note, most herbs have a common simple name and a technical name. I include this professional name because some books, stores, and research papers use the technical one. I will only discuss the best natural options, so the list of herbs to learn will be small. And with this book open, you can easily order these yourself. Having the guidance of a herbal Lyme expert or a naturopathic doctor might make purchasing easier. So, a herb may be listed as Japanese knotweed or Polygonum cuspidatum. I will use both. Sample Lyme, Babesia, and Bartonella. Herbal treatments. Foam and Zhang showed in a test tube study that some natural treatments have a good ability to kill Lyme, possibly superior to doxycycline and cefuroxime, intravenous rocephin. Indeed, these researchers found that 7 herbal extracts at only 1% potency killed Lyme effectively. These potent treatments were Polygonum cuspidatum root, Japanese knotweed, Uncaria tomentosa, cat's claw or cemento. Cryptolepis sanguinolenta. Scutellaria bicalensis, Chinese skullcap. Artemisia annua, sweet wormwood. Juglans nigra, black walnut. Zhang found 5 herbs that interfere with Babesia. These are Cryptolepis sanguinolenta, Artemisia annua, sweet wormwood. Scutellaria bicalensis, Chinese skullcap. Alcornia cordifolia. Polygonum cuspidatum, Japanese knotweed. Finally, we cannot ignore Bartonella. It may be more common than Lyme disease, and Bartonella can cause hundreds of medical and psychiatric problems. Bartonella is carried by many types of insects, not merely ticks. Herbs that kill Bartonella bacteria include Cryptolepis sanguinolenta, Juglans nigra, black walnut, Polygonum cuspidatum, Japanese knotweed. Herbs that kill all 3: Lyme, Babesia, and Bartonella. Why Zhang found that at least 4 herbs kill Lyme, Babesia, and Bartonella. Cryptolepis sanguinolenta, return healthy brand. Black walnut, Juglans nigra, Horbach brand. Japanese knotweed, Polygonum cuspidatum. Purity Labs transresveratrol. Chinese skullcap, Scutellaria bicalensis, Horbach brand. The good news. A number of natural treatments appear to defeat Lyme, Babesia, and Bartonella, if test tube studies are trustworthy. It would not surprise me if 1 million people have tried each of these herbs throughout the world over at least hundreds of years. Finally, you should know that those who prescribe herbs like to use more than one herb. This benefit is like using 1 + 1 + 1 to equal 10. Now let us look at these winning herbs before you blindly use them. Cryptolepis sanguinolenta. Cryptolepis is amazing. It is an antibiotic, antiviral, antifungal, and antiparasitic treatment. It will even bake cookies for you. It can, however, lower fertility in both genders. It should not be used with patients trying to get pregnant. This is why some healers only use it for short periods of time. My opinion is that it is wise to consult a herbal medicine expert if you are trying to get pregnant or are pregnant. This may apply to both men and women. In 2021, Dr. Y. Zhang did test tube studies that amazingly showed that only a weak, 1% potency of Cryptolepis sanguinolenta extract caused complete eradication of Lyme. Other herbs and 2 traditional antibiotics were not this powerful against Lyme, because after 3 weeks, the Lyme bacteria were still visible. Finally, Cryptolepis has an unpleasant taste. So, my patients prefer it with glycerin as a liquid or as a capsule. Just be sure to check the date on the capsules since you want fresh ones. Japanese knotweed, Polygonum cuspidatum. Japanese knotweed is strong enough to treat Lyme in the brain and heart. It may reduce the die-off or Herx reactions. A Herxheimer reaction is discomfort after an effective herb kills an infection and the resulting debris creates strong body inflammation and a strong immune response that feels miserable. Surprisingly, Japanese knotweed blocks some of the excess inflammation from infections. It stops some of the inflammatory chemicals called cytokines. Knotweed is the only herb that blocks MMP1 and MMP3. Japanese knotweed is protective of brain nerves. It also contains resveratrol, specifically, transresveratrol, which is the most useful part for eliminating your infections. Resveratrol is pure standardized Japanese knotweed. Buhner suggests not using resveratrol from grapes. Top herbalist Stephen Buhner suggests using this herb to treat both Lyme and Bartonella. In his Bartonella textbook, he also says Japanese knotweed protects the fragile lining of your blood vessels, which Bartonella clearly infects. Zhang has shown that it treats growing and persister states of Lyme and Bartonella. This is a big deal, but only if you comprehend the power of persister cells. It has been said that after a nuclear bomb only cockroaches would survive. After antibiotics wipe out much Lyme and Bartonella bacteria, it is not all gone. The Lyme and Bartonella persisters remain. And Japanese knotweed helps defeat them. This is exciting since some people relapse because of hardy persisters. A typical dose for an adult is 200 mg twice a day for 3 days and increase every 2 days for a top dose of 800 mg twice or 3 times a day, modified from Dr. Bill Rawls. Stephen Buhner suggests a tincture for 3 different infections of 1 teaspoon 3 to 6 times a day. In his Bartonella book he suggests 1 capsule 3 times a day, Green Dragon Botanicals. Andrographis or Andrographis paniculata. Andrographis treats many viruses, such as the flu, COVID-19, and hepatitis B and C. It also kills harsh bacteria like E. coli. Surprisingly, it also kills roundworms and tapeworms. H. Zhang reports that it has anti-tumor, antibacterial, anti-inflammation, antivirus, anti-fibrosis, anti-obesity activity, and according to Okwarobo, it also kills malaria and protozoa. These are single-celled parasites like Babesia. Okwarobo reviewed all major research on safety and concluded, the results of numerous toxicity evaluations of extracts and metabolites isolated from this plant did not show any significant acute toxicity in experimental animals. In Buhner's book Healing Lyme, he reports andrographilide is effective against Lyme in 60% of those ill with this infection. Rawls suggests using andrographis in adults at 200 to 800 mg as an extract standardized to 10 to 30% andrographis. Start with 1 dose each day for 3 days and then take it twice a day. Tang reports a daily dose of 600 to 1,800 mg of the extract to treat ulcerative colitis in a human study. Sometimes an ingredient is listed as 10% andrographilides. Andrographilides are the effective herbal chemical in this herb. Buhner suggests 600 mg capsules 3 times a day for a week and suggests increasing to 1,200 mg 3 times a day if tolerated. It tends to have more side effects than other natural treatments. Finally, if you are having inflammation labs done at Radiance Labs, LH14, and National Jewish Health, Th1 or Th2 panel A only, your doctor may be able to track the inflammation chemicals making you miserable. The National Jewish Health website does not show this panel clearly. Your doctor will need to set up an account. In the laboratory, Sanborn found andrographis lowers TNF-alpha, IL-1 beta and NF-kappa B. The ability to target cytokines or inflammation precisely is exciting. Since it tastes so bitter, some practitioners suggest putting it in capsules. In a Thailand study, the only side effects were increased immune system cells, a lower alkaline phosphatase, a rise in urine pH, and a brief decrease in blood pressure. No person experienced serious side effects. Howtuinia chordata. About 18 years ago, I met and became friends with the leading Chinese herbalist in America, Dr. Qing-Kai Zhang. After our initial meeting in Philadelphia, Qing-Kai flew to Naples, Florida to discuss the high purity of his herbs and his exhaustive quality testing. And then he listened to my self-funded research on the effectiveness of 2 of his herbs, including HH or Howtuinia chordata. Simply, I found that 3 HH per day was not strong enough to kill most Bartonella. So, Dr. Zhang doubled the potency and called it HH2. His press release said, Dr. James Schaller has done clinical observations and found that with higher dosage, the therapeutic efficacy improves. He suggested that we produce a double-strength version. Now the double-strength HH2 capsule is available. Over the last 15 years my research suggested this herb is good at hindering Bartonella and lowering the number of Bartonella bacteria. But I do not believe it is typically curative at any dose, since at very high doses for a year you can still see Bartonella on a blood smear. Currently, you can purchase this from Dr. Zhang's son, Dr. Yale Zhang at the Zhang Clinic NYC. It is now called HHM. Zhang Clinic 914-259-0346. Or purchase online, drrons.com. One possible option is to use the essential oil of Howtuinia after it is tested aggressively for purity and safety. Not all brands are pure. It is already in use for many antiviral and antibiotic purposes, according to Pang. Finally, with all the excellent biological uses of Howtuinia, Please note it also lowers inflammation chemicals which likely contribute to your illness and discomfort. If your doctor is using Radiance Labs and National Jewish Health to measure inflammatory cytokines, look for the Hawthornia herb or its essential oil to reduce TNF-alpha, IL-1 beta, IL-6 and IL-8. If you use routine national labs to measure special inflammation chemicals, cytokines, interferons, and interleukins, you will only get negatives over and over again, even if you are very ill. Cat's claw, cemento, or Uncaria tomentosa. Cat's claw has been used for thousands of years by the people of the Amazon. The inner root or vine bark is the source of this herb. It has strong anti-inflammatory benefits and calms excess immune reactivity. It is used for high blood pressure, asthma, cancer, diabetes, arthritis, and neurodegenerative diseases. More than 200 compounds have been isolated from Uncaria. This herb is used by natural healers for Lyme disease. But only limited research supports this use. Even PubMed, with tens of millions of medical studies, showed only one looking at Lyme and Uncaria together, authored by Feng Zhang and Feng, showed cat's claw is one of the top herbs in the treatment of Lyme disease. Finally, do not use if you are pregnant, and be aware some people have nausea, belly spasms, and diarrhea. Adult dosing is 400 to 800 mg of inner bark standardized to 3% alkaloids or 10:1 concentration of the inner bark, RALs. Buhner suggests a 1:5 concentration in 60% alcohol at about 50 drops taken 1 to 3 doses a day. It should be taken with food, according to RALs, because stomach acid makes it work. Otoba parvifolia, banderol. At a recent conference on Lyme, Babesia, and Bartonella, a number of doctors reported using banderol with success. Years ago, I did self-funded research on this herb. I was unable to come to a conclusion. And on PubMed, little existed on this extract. However, the combination of Otoba parvifolia, banderol, with Uncaria tomentosa, cat's claw, was evaluated for its ability to kill Lyme in a lab. Extracts from these two plants were tested for their effectiveness on active and dormant forms of Borrelia burgdorferi, a species of Lyme, demonstrating significant effects on all its forms, especially when used in combination. Artemisia, artesunate, and artemisinin. If you really want to learn about this family of herbs, please see my free book offered on personalconsult.com. It is the #1 book on Amazon.com on this topic. One concern I have is that some doctors prescribe the plain, unchanged herb Artemisia to kill Babesia. I reported in 2006 that the plain Artemisia herb is too weak to kill Babesia. Elfowell found that both Artemisia annua and artemisinin did not kill Babesia. Artemisia annua has been used for millennia to treat parasites and fever-related ailments caused by various infections. Although effective against many infectious agents, the plant is not a miracle cure and there are infections where it has proved ineffective or of limited value. It is important to report those failures. For example, Artemisia annua, artesunate, and artemisinin were ineffective in reducing or eliminating Babesia in infected mice. Therefore, if you use potent semisynthetic artesunate, try to take a high dose and never believe one treatment will kill your Babesia. Also, it should be mentioned that Artemisia annua has an essential oil. These can be very strong treatments. My only concern is it has a significant amount of camphor, which is in many cold and flu medications that are available without a prescription. Camphor is in Vicks Inhaler, Tiger Balm, some emu oils, and Vicks VapoRub. Currently I would start with 2 capsules of artemisinin 100 mg to 200 mg twice a day for 5 days to see if you are sensitive to this mild treatment. For example, many people with Lyme, Babesia, and Bartonella can develop reactive mast cells which carry about 1,000 chemicals which can make you feel poorly. If you do react, use weak Artemisia herb with no alteration so it does not make a large amount of Babesia die-off debris that fires up the immune system to make inflammation chemicals. However, if you tolerate artemisinin at 100 mg to 200 mg, double the dose after 5 days to 200 mg to 400 mg per day. Purchase this from www.drons.com. They offer a fairly strong form that was made twice as strong based on my research, Q Zhang. Now it is called Artem. Also, some doctors like to administer artesunate into your muscle or by intravenous. One possible dose is 120 milligrams. My friend Henri Lindner, an exceptional Babesia scholar, and I have independently settled on artesunate as one very useful way to kill Babesia. And it seems this was accepted many years ago. Artesunate is superior to artemisinin according to Janssen. However, we both strongly believe that using a single herb or synthetic treatment will not cure you of Babesia. I suggested this in my 6 Babesia books in 2006, but Lindner extended this hunch with great clinical creativity and has proved it clinically. The essential oil of Artemisia annua, consisting of camphor, 44%, germacrine D, 16%, was screened for its antimicrobial activity. The essential oil remarkably inhibited the growth of tested gram-positive bacteria. Camphor should be used carefully and not regularly because it is a neurotoxin. Intravenous or muscle-injected artesunate. Artesunate for injection is the treatment for severe malaria in adult and child patients. Artesunate for injection, 110 mg or 120 mg is intended for intravenous administration. In 2022, the CDC and FDA approved intravenous use of artesunate for cases of severe malaria and strongly recommended it be stocked in ERs and other locations with possible malaria patients. Why am I discussing a malaria drug that might work very fast? My good friend, Valerie Viale Fuller, founder of Band-Aid Lyme, LLC, repeatedly almost died from Babesia many times. No one thought to give her intravenous artesunate. In my opinion, Babesia is much harder to kill than malaria. Currently, a pharmaceutical company is being aggressive in trying to get intravenous artesunate distributed widely. Here are their homepage comments. No FDA-approved injectable malaria medication has been available in the US since intravenous quinidine was discontinued in early 2019. Artesunate for injection fills this need. Healthcare professionals having difficulties obtaining products from our distributors should contact the Ameva's Medical Affairs line below. This line is open 24/7 and 365. Ameva's Medical Affairs. 18555 Ameva's. Artesunate for injection, manufactured by Ameva's, is approved by the FDA and is commercially available in the United States. FDA-approved artesunate is available for purchase from major drug distributors. The CDC mentions that artesunate for injection can be given in infants, children, adults, and pregnant women. Intravenous artesunate can cause serious red blood cell problems which require transfusion. So, they suggest after giving artesunate intravenously, monitor patients starting at 7 days and up to 4 weeks after receiving intravenous artesunate is recommended. https://www.cdc.gov/malaria/new_info/2020/artesunate_approval.htm. Much of the world uses artemisinin-based combination therapies, or ACT, against Babesia's cousin, malaria. But what is ACT? It is the use of an Artemisia derivative combined with a different synthetic malaria killer. The World Health Organization is strongly supporting using a herb and a synthetic drug together, and these are called artemisinin-based combination therapies, which are now being used in more than 50 countries where malaria is common. Therefore, we have massive experience using herbs with synthetic malaria drugs. All Babesia treatments are malaria treatments. This is a possible lesson that I hope flows from this book. Using herbs and essential oils together with synthetic pharmacy medicine might often be useful in killing malaria, but also Babesia. The latter can be fatal or cause sweats, chills, headaches, air hunger, or significant fatigue. So let us look over Price's summary below, as he lists herb and drug combinations that are effective. The most common combinations to kill malaria are artemether-lumefantrine, Cordum. Artesunate imodiaquine. Currently it is not available in USA or UK, but it can be acquired by Canadians under the Health Canada Special Access Program. This is associated with the Canadian Malaria Network. My good friend Ian, the top pharmacist at Cripps Pharmacy in Canada, reported one would have to prove a need. Artesunate sulfadoxine pyrimethamine, Fansidar. Artesunate mefloquine, mefloquine is Lariam. Dihydroartemisinin piperaquine. Janssen reports that dihydroartemisinic acid is very unstable and decomposes too easily. So, despite its potency, it has limitations. The consensus from my discussions with Babesia literate physicians is that the herbal derivative artemether in the Cordum combination drug with lumefantrine is very well tolerated. The herbal part is artemether, which is synthetic. Many Lyme literate doctors prescribe 8 tablets a day for 3 days, a bit aggressive. Personally, I have never had a patient have side effects on Cordum at any dose. Garlic and synthetic garlic. Garlic oil helps eliminate Babesia duncani. Dr. Yumin Zhang found in lab experiments that routine CDC treatment with atovaquone, meprin, and azithromycin, Zithromax, killed some Babesia, but with relapse. This fact seems to be ignored by some Babesia researchers who seem to be unable to update this one treatment approach to killing Babesia. But adding garlic oil to azithromycin, Zithromax, killed the Babesia without any relapse. I have been using garlic oil, or semi-synthetic garlic for about 29 years. The primary side effect is a strong body smell and possible mild stomach upset. So how can you benefit from garlic oil? It is best to start slowly with sensitive people using a simple garlic called a limed. Dr. L. Robert Mozzaieni, the Bartonella expert, suggests this product. I agree. If that goes well at high dosing, move to garlic oil. You do not want to use an essential oil or semi-synthetic garlic yet. Use a plain garlic oil. Brands to consider are Puritan's Pride or Nature's Way. But please notice that many garlic supplements are odorless. Avoid these products because the strong smell is a sign you are taking a brand that works. This is a careful and gentle approach. Start with regular garlic or a limed. Then move to a gentle oil. And then consider a semi-synthetic powerful garlic medicine called allicin from the Zhang Clinic in NYC. This is the best approach if you are sensitive to medications, have mast cell activation syndrome, MCAS, PANDAS or PANS. Eventually, the goal is to have you take semi-synthetic garlic from the Zhang Clinic. In 2006, I read Qingkai Zhang's book on Chinese medicine to treat Lyme, Babesia, and Bartonella. And then I spent hours with him in Florida learning the extensive purity testing he used, but he also emphasized the potency of his special semi-synthetic garlic, which I believe saved the life of his son when given intravenously decades earlier in China. Simply, order the allicin product from the Zhang Clinic in NYC. But please understand that while Qu Zhang's product is called allicin, it is not simply regular garlic. To illustrate the potency, note that one small capsule will give you a profound garlic smell for 36 hours. Why Zhang found that garlic essential oil had profound action against Babesia. Finally, Why Zhang, at Johns Hopkins, routinely publishes pearls for the treatment of Lyme, Babesia, and Bartonella. In 2020, Why Zhang and his team identified essential oils with high activity against Babesia duncani. They screened 97 essential oils and identified garlic oil as a top treatment to remove Babesia. Black walnut, Juglans nigra. Black walnut was also shown to reduce Borrelia burgdorferi in test tubes by the Zhang team at Johns Hopkins. Fong found a mere 1% extract of black walnut had better activity against B. burgdorferi, a common species of Lyme disease bacteria, compared to the antibiotics doxycycline and cefuroxime in a lab study. Initially, I was not finding much on this herb regarding its antibiotic abilities in many top naturopath textbooks, herbal textbooks and PubMed's 34 million articles. But, in addition to Feng's report that mentioned its strong effects against Borrelia, black walnut is mentioned in the Naturopathic Herbalist, in which naturopath Dr. Marissa Marciano reports benefits against bacteria dispersed throughout the body, and yeast infections, and even treats parasitic worms. It can be a laxative, so high dosing might cause loose stool. Naphthaquinone juglone, one of the active components in black walnut, is antifungal, a toxin, antimicrobial, and antiparasitic. The suggested tincture is 1:4, 25% with 5 to 10 drops 3 times a day with a maximum dose of 15 milliliters a week. She suggests doing 2 weeks on and 2 weeks off. Woodland Essence suggests a dosing of 10 to 30 drops, or 1/8 to 1/4 TSP 3 times per day in juice or water. Ho reported that black walnut extract may lower inflammatory chemicals called cytokines. Lowering the levels of certain cytokines might make you feel better. While there was variation among varieties, as a trend black walnut lowered inflammatory chemicals or cytokines. She concludes, the results of this study demonstrated for the first time that black walnut possesses compounds to lower 6 measured cytokines, TNF-alpha, IL-1 beta, IL-6, IL-8, IL-10, and MCP-1. This research used human cells stimulated by a very common bacterial chemical, LPS, which causes profound immune reactivity. Therefore, an effective dose of black walnut can cause aggressive killing of the infectious agents, but the inflammation may be less with this herb because the cultivated plants used for Ho's research lowered the cytokine gasoline. Specifically, black walnut reduced between 1 cytokine to as many as 6 of these inflammatory chemicals, depending on which subtype of plant was used for the extract. Alchornea cordifolia. Alchornea cordifolia extracts showed good inhibitory effect against Babesia duncani according to Zhang. It has antimicrobial and anti-inflammatory activity. Alchornea cordifolia has been used by traditional herbalists in several African countries for the treatment of malaria, which is similar to Babesia. Studies suggest significant anti-malarial effects. The active constituents of Alchornea cordifolia extract are complex, including ellagic acid and quercetin. Ellagic acid has previously been shown in the lab to fight against malaria. But it also might become a new herbal product to consider to kill Babesia. Ellagic acid, or EA, is found in various plant products and has antioxidant, antibacterial and effective anti-malarial activity in the lab and the body without toxicity. Ellagic acid can kill Babesia. If you wish to try this herbal extract, look at pomegranate extract 500 mg with whole fruit ellagic acid from Source Naturals. Essential oils used against Lyme, Babesia, and Bartonella. Among the 250 essential oils which are commercially available, about a dozen possess high antimicrobial activity. Ma argues that the current treatment for Bartonella infections is not very effective due to antibiotic resistance and also persistence. He tried 32 essential oils against Bartonella. The most effective Bartonella death happened with the essential oil of oregano, cinnamon bark, mountain savory, winter, cinnamon leaf, geranium, clove bud, allspice, geranium bourbon, ylang ylang, citronella, elemi, and vetiver. Carvacrol and cinnamaldehyde, the active ingredients of oil of oregano and cinnamon bark oil, respectively, were able to remove Bartonella totally even at low doses. Fong also reports some thoughts about essential oils. He looked at 34 essential oils against Borrelia burgdorferi, Lyme. First, he quotes Winska, who found that not all essential oils had activity against the Lyme bacteria. But they did find 5 essential oils, oregano, cinnamon bark, clove bud, citronella, and wintergreen, which even at low doses killed the hard-to-remove persister cells of Lyme. Interestingly, some highly active essential oils were found to have excellent antibiofilm ability. They dissolve the biofilm-like structures. I published similar positions in 2014 in my free textbook Combating Biofilms. I reported in 2014 that select essential oils, particularly oregano, cinnamon, and clove bud, destroy Lyme biofilms. Combinations of essential oils work best, and the stomach has to be protected if one goes to a high dose. Soothing protective herbs are marshmallow root, aloe vera in capsules, and slippery elm. Nature's Way is cost-effective and useful. I have not seen one that is better than another. Consider using one stomach herb for a week and then switching to another. Amazingly, oils of oregano, cinnamon bark, and clove bud completely eradicated all viable Lyme bacteria without any regrowth. Citronella and wintergreen were not as effective. Carvacrol and oregano oil had excellent activity against Lyme. In 2020, Wei Zhang and his research team identified essential oils with high activity against Babesia duncani. They screened 97 essential oils in the lab, and identified 10 that were effective against Babesia and further narrowed their search for the two most effective compounds, garlic oil and black pepper oil. They also found that the routine recommended treatment for Babesia can have relapses. Specifically, atovaquone liquid, Meprin, and azithromycin, Zithromax, at high dosing can allow the Babesia to return. In contrast, the combination of garlic oil and azithromycin showed eradication of Babesia at low dosing. Gok investigated 47 fats and oils, testing them against moving Borrelia, Lyme spirochetes, as well as the round-shaped persister cells that survive common antibiotics used in the treatment of Lyme disease. These bacteria are protected by a strong protective slime or biofilm layer. Only bay leaf oil and cassia oil, which have eugenol and cinnamaldehyde, destroyed different stages of Lyme disease, and also its protective biofilm. I made a similar report in my 2014 textbook Combating Biofilms. One helpful study investigated volatile oils including 3 essential oils, oregano oil, cinnamon oil, and clove oil. All 3 were even more powerful than daptomycin, an antibiotic shown to kill Borrelia's persisters. These Lyme cells are usually alive and persisting after full antibiotic treatment. And then slowly patients feel the Lyme disease returning. A practical issue in using essential oils is what brand to use and what is the daily dose taken with food. After 25 years of use, I doubt a very low dose will do much. For example, I have seen good results with the application of clovenol to infected gums applied most evenings. But I do not believe this dose on the gums enters your bloodstream and kills pathogens, such as Borrelia, Babesia, and Bartonella, in your joints, intestines, or brain. Cinnamol is a compound I have used since 1998 because it defeats the protective biofilms routinely seen with infections. Biofilms make common antibiotics fail. A biofilm may make killing the bacteria 20 times harder to remove. Moreover, this substance suppresses the Candida species and its biofilm. When I was learning the basics long ago, none of this information was clear. But perhaps you are wondering exactly how the top essential oils are taken? Are they put into a nebulizer to spread mist throughout the nasal cavity? No. There are a number of high-quality essential oil companies. But all my self-funded research has been with the products made by North American Herb and Spice. Typically, I have patients buy 3 products, oregano gel balls, clovenol liquid and cinnamol liquid. I typically have patients slowly add 2 oregano gel balls 3 times a day to meals and increase if tolerated. The clovenol and cinnamon liquids are placed inside the capsules with stomach protective herb powder. My patients buy inexpensive Nature's Way marshmallow root, aloe vera capsules, or slippery elm. Take one of these 3 protective stomach herbs and open the capsule. So, for example, take a marshmallow root capsule, pull it apart, and discard half the powder. Next, drop in the essential oil into the open capsule space. Close up the capsule. The hope is that the stomach will be fine. I typically start with 1 drop 3 times a day with reactive, sensitive people, those with mast cell syndrome, PANDAS, or PANS. If this starting oil dose does not bother your stomach, I increase it by a drop every 2 days. With enough stomach protective herbs, most patients are able to reach 10 drops, always taken with your 3 daily meals. I rotate my 3 favorite essential oils mentioned above, so all are used in 3 days. Chinese skullcap, Scutellaria bicalensis or Calvaria. One principle promoted by my natural medicine doctor friends is the benefit of combining herbs. In Chinese skullcap, we have a herb that improves the absorption of other herbs. This is an amazing feature. It is also a good antiviral. And ticks carry a number of viruses like Epstein-Barr, Parvo, Mycoplasma pneumoniae, HHV6, a herpes virus, Coxsackie, and SARS-CoV-2, which causes COVID-19. It is good for calming allergies, autoimmunity, and is protective of nerves. Since Lyme disease, Babesia, and Bartonella can cause all three problems, it is a nice option. But this herb is also a top killer of three forms of Lyme disease, such as the active spiral bacteria, round persister forms, and biofilm-protected bacteria hiding behind a protective slime. Cystis incanus, or Cystis creticus. Some people believe Cystis creticus and Cystis incanus are the same herb. Clinical studies show the volatile oil extract of Cystis creticus to have antibiotic and antibarellial effects in the lab. Additional lab studies have shown Cystis creticus to have broad and effective antimicrobial effects against several bacteria. Cystis creticus also defeated a strep biofilm. Cystis incanus plant extracts have been used for centuries in traditional medicine without reports of side effects or allergic reactions. In a randomized placebo-controlled study of 160 patients, 220 mg per day Cystis incanus was well tolerated with less adverse effects than in the placebo group. Teasel. Dipsacus sylvestris is known as wild teasel or Fuller's teasel. Its extracts have been studied against Lyme disease in the lab by Liebald. Teasel prevented all growth of the Borrelia spirochetes. Wild teasel has been examined as a Lyme treatment. Previously, all the antiborrelia research focused on the root, which is not effective against Lyme. However, the leaves demonstrate useful antimicrobial effects. Lowering Herx reactions with herbs. There are many articles promoting nutrition, saunas, lymph massage, hyperbaric treatment, binders, and dozens of other options to lower your discomfort caused by the infection die-off debris resulting from strong and effective herbs and essential oils. I will only discuss herbal Herx options. In past discussions with Dr. Qingkai Zhang, the leading USA Chinese medicine expert, he believed his Purin M herb could lower the discomfort of inflammatory debris from pathogen die-off resulting from effective treatment of infections. I would try one Purin twice a day for 3 days and then one 3 times a day. It does not always work, but it is worth a try. Purchase at Zhang Clinic 914-259-0346. Online availability. drons.com. Zhou reported the beneficial effects of Purin are due to dilation of blood vessels, heart protection, reduced inflammation, brain protection, calming free radicals, and lowering pain. Therefore, this has potential to lower Herx pain. Try it for 5 weeks. Chlorella. Years ago, I was hired to research a fascinating form of pulverized chlorella as a toxin binder, particularly of heavy metals. Chlorella is a form of green algae, packed with many vitamins, minerals, and protein. It has also been proposed by Haruka as a binder of chemicals that try to harm the body by resembling estrogen, called xenoestrogen where xeno means foreign. These foreign estrogens may promote cancer. Some believe that chlorella may bind a wide variety of inflammatory chemicals, but that is for another book. In my research, I found that one product called NDF Organic from Bioray.com removed metals in hours, not days. Try a full dropper the instant you wake up before eating or drinking. You do not want it merely removing toxins in your food. You may lose some heavy metals and chemical xenoestrogens that cause cancer. And it might bind inflammatory chemicals and toxins from die-off debris. Dandelion root. Dandelion root is believed to promote the liver's role to help remove inflammatory chemicals which cause discomfort. Gonzalez Castellon reported that the evidence suggests that dandelion root's many plant chemicals have antioxidant and anti-inflammatory activities in many areas of the body. Modified citrus pectin. Try to start with 2 times a day at least 90 minutes away from food or herbs. Consider using Pectisol brand. Modified citrus pectin lowers or removes heavy metals and possibly infection die-off debris. There are extensive publications about its use as a supplement important in breast, prostate, and melanoma cancer treatment. It inhibits galectin-3 which may promote cancer relapse and tumor progression. Source: drrelias.com. Optifiber lean. Nathan, quoting J. Callahan, suggests that optifiber lean may be a very strong binder. I have no opinion. I do wonder if some binders, like cholestyramine, lower fat-soluble vitamins as they bind fatty chemicals. I am still studying this issue, but doubt it is a routine problem. Japanese knotweed. Japanese knotweed has a calming effect on the infected body. Japanese knotweed blocks some of the excess inflammation from infections. It stops some of the inflammatory chemicals called cytokines. For example, knotweed is the only herb that lowers MMP1 and MMP3 in a mouse study. Knotweed is highly active, impacting MMP9, lowering IL-6 and TNF-alpha, and possibly altering COX-2. Resveratrol from knotweed has a protective effect against sun damage in mice, and some think this might occur in human cells. Cannabis derivatives. CBD, CBG, and THC from cannabis require a look at how cannabis impacts Herx reactions. Tumor necrosis factor alpha, TNFA, interleukin, IL-1 beta, IL-6, and interferon gamma were the most commonly studied pro-inflammatory chemicals, and their levels were consistently reduced after treatment with CBD, CBG, or a CBD plus THC combination, but not with THC alone. In 22 studies, in which CBD, CBG, or CBD in combination with THC were administered, at least one inflammatory chemical was reduced. And, in 24 studies, there were some improvements in disease or disability. THC alone did not reduce pro-inflammatory cytokine levels, but resulted in improvements in neuropathic pain in one study. CBD, CBG, and a CBD plus THC combination exert a predominantly anti-inflammatory effect in bodies, not merely in laboratories. Quercetin. Quercetin is an example of an anti-inflammatory plant pigment that lowers cytokines, such as interleukin-1 beta, IL-1 beta, tumor necrosis factor alpha, TNF-alpha, interleukin-6, IL-6, and interleukin-8, IL-8. These are best evaluated by Radiance Labs' 14 cytokine inflammation panel and/or National Jewish Health Laboratory Advanced Inflammation Chemicals (TH1 or TH2 panel A). Physicians can only access the latter by calling them, since this precise panel does not exist on their website. Your sample has to be shipped on ice, and the panel costs approximately $280. Using other routine, national laboratories to measure levels of advanced cytokines, interleukins, and interferons is a complete waste of time.